Hello, welcome to my YouTube channel. Happy World Homeopathy Day to all of you. Today I felt to discuss topic which is Tuberculinum nosode and tubercular miasm as well. So we will see this thing in detail in this video. So stay tuned and please subscribe to my channel if you have not subscribed yet. So let us start with this. Firstly, we will pay tribute to Dr. Hahnemann on his birth anniversary for his hard work in the field of homeopathy. And you all might be knowing that theory of chronic diseases was introduced firstly by Dr. Hahnemann during his homeopathic practice. The reason to discover or introduce the theory of chronic diseases was he was not getting the desired result in the treatment of chronic diseases. He found difficult to treat them because they are reoccurring in the patient even after giving single simple remedy. So Dr. Hahnemann introduced the three principal miasm in the homeopathy, that are sora, psychosis and syphilis. So, SORA, which is responsible for functional disturbance in the organism, whereas psychosis is responsible for overgrowth, that is proliferation and infiltration in the tissues, whereas the syphilis is responsible for destruction and ulceration of the tissue. So this was the three principal miasm introduced by Dr. Hahnemann, and the fourth miasm which we are going to see in detail, that is tubercular miasm, was introduced by Dr. J.H. Allen. So tubercular miasm and tuberculinum as a nosode we will see. So tubercular miasm means it's a combination of all the previous miasm, or it is a combination of sora and syphilis, so it is also known as pseudosora. Tubercular miasm means it is a chronic disease of tuberculosis. It can affect any part of the body, but especially it affects the lung. Mentally, this miasm will create a need for exploration and curiosity. So, desire for change and traveling is seen in this miasm. But the traveling is a peculiar type, that is no destination is fixed in the traveling, just they want to roam or wander from one place to other. No destination is fixed in this type. Now we will see what are the indication of tubercular miasm. So tubercular miasm will be suited to the people who have their own history or family history of tuberculosis. They have lean thin constitution, they eat well but they are emaciated, they have sensitivity from cold air, they get frequent attack of cold and cough, they have inflammation of glands, especially tonsils are inflamed in them. Hemorrhage from nose, even after slightest blowing of nose can start bleeding from the nose in them. With this they have allergies to fur, and they have desire to drink cold milk. With this they also have fair type of complexion, and they have long eyelashes. A person with tubercular miasm will have low immunity, they will catch infection very easily, and their disease will be progressed fast. So this is seen in the tubercular miasm. Mentally, the tubercular miasm will have dissatisfaction, lack of tolerance. They will change their things, their mind, their plan very easily. They are unpredictable kind of people. They are sometimes they are cheerful, sometimes they are depressed. They will lose interest in the things very easily. Along with this, they can harm to themselves. This was all about tubercular miasm. Now we will see what is tuberculinum nosode. So tuberculinum nosode is a drug which is prepared from the diseased part, that is nosode means the drug which are prepared from the diseased part. So tuberculinum nosode is prepared from the tubercular abscess, that is pus is taken and potentized from the tubercular abscess, and tuberculinum nosode is prepared. Now question arises when to use nosode. So there are few indications to use nosode in your practice. So first indication is that when your well selected remedies like sorinum, sulfur fail, in that case you can use nosode. Second indication is you can use it as an intercurrent remedy, means when your case comes to standstill position, मीन्स दवाई देने के कुछ समय बाद अगर पेशेंट के सिम्टम उसी जगह पे फिर से आ जाए और उसमें कुछ अच्छा प्रोग्रेस नहीं दिख रहा हो तो आप एज ए इंटरकरेंट रेमेडी उसे यूज़ कर सकते हो. ऑल्सो यू कैन यूज़ नोजोड टू बूस्ट द एक्शन ऑफ द ड्रग. If you think about nosode or tuberculinum nosode specially, I would like to share that the frequency of prescribing the tuberculinum nosode should be after 15 days, 1 month or 1 year, and the potency like 1 m act very well in patients, and as they're deep acting, so don't repeat it frequently, and be careful while prescribing it to heart patients. So please, this thing you should keep in mind while you are prescribing nosode like tuberculinum. Now I will be sharing tuberculinum nosode as a drug picture for homeopathic student, and also it will be helpful in recognizing when the patient enter in your clinic. Tuberculinum is a type of nosode, and nosodes are such type of medicine in which disease part, or you can say the portion of the disease part, is taken and potentized. In the case of tuberculinum nosode, the tubercular abscess pus is taken and it is potentized for making a homeopathic medicine. Tuberculinum patients are emaciated, anemic, in look wise. Even they eat well, the body is lean thin, their body is like slender in shape, they have narrow chest, fair in complexion, blue eyelashes sometimes. With this they have frequent attack of cold, they catch cold very easily, they have low immunity, and also they have desire for cold milk and sweet. Also in every change of weather the complaint get aggravated. In this case you can think of tuberculinum if they have family history of tuberculosis. They have a swollen gland, means the inflammation of gland is seen in tuberculinum patient. Mostly they have recurrent attack of tonsillitis. If you want to learn tuberculinum as a theme wise, you can see the tuberculinum patient have desire for freedom. In both way, mentally and physically they want freedom, and this is also seen in the respiratory complaint of the patient. They have sensation of suffocation if they have bounded or restricted, they feel suffocated, and this is a theme you can say in the case of tuberculinum nosode. There is changes of symptom, and the symptoms begin and stop suddenly. Tuberculinum persons are not orthodox kind of people. They hate doing same job for a long time. They have desire and their desire changes, and after doing something and changing something like occupation or home decor or traveling, they get bored easily and they are dissatisfied even after changing. They don't know what they want, and so they are like a discontent type of people. They are the type of people who can do the job which can give them excitement and chance to explore the world, or chance to do something new each time, so they can keep their mind busy in planning, and doing such job can make them happy, and they will love doing such type of job like traveler, so that they can get chance to explore the world. Tuberculinum patients have less attachment and closeness bondage with people. As they are cosmopolitan people, they love to change their friends and like to explore more friends and make a relationship. They are social, but they are not very close toward anyone. Tuberculinum patients are not satisfied with their own self and with any other. They are the people who are very impulsive in their action, and also you can see that once you understood tuberculinum nosode or tuberculinum drug, you will never miss it in your clinical practice. Also, they are very bold, confident kind of people. They love to drive fast, especially they love to drive fast car, and they enjoy the wind blowing on their face. As I said earlier, that they love to travel. That tribal desire for rubric is also seen in tuberculinum. So they like to explore the mountain, then forest and dry climate areas. They have aggravation from cold and damp places, so they like to explore mountain tops, forest and dry climate areas. They are the people who are very easygoing and they accept other new point easily. They are adventurous. Means they will discover, not discover. Discover means which is already there, but they are adventurous. They will make new path, and any work when given to tuberculinum person, they will do it in a newer way. They are very innovative persons, and they will always think out of box. They have lot of ideas and plan in doing work. They do their work very nicely, but the thing is that they can't stick to the work, and they will keep doing the new things, and they will not finish the earlier thing which they have already taken. Now we will see tuberculinum as a child. So to describe tuberculinum child, a few words like naughty, obstinate, destructive, stubborn, and mischievous. These words are enough to describe tuberculinum child. Also, they are precocious children, and the parents will complain that they do not listen to them, they trouble them a lot, they are naughty and mischievous. The child is so internally restless that it can be seen on the physical aspect. Like he will not keep quiet during your case taking. He will keep on touching your BP apparatus, your stethoscope, your pain. He will not allow you or will disturb you while you're noting or you're taking case taking of that person. He will also not allow to his parent to talk with you. He can or she can break your things. They have destructive tendency in them. Also, the parents will complain that the child is breaking the valuable thing intentionally. When you say that this thing is very costly or it is very important for you, they will purposefully break it. Gratification is also seen in tuberculinum. The child parents will say that uh, अगर उनकी इच्छा पूरी नहीं हुई तो the child will kick and scream and howl, and also they may fall on the floor for making the things done as per them. Tuberculinum is one of the drug for temper tantrums in children. It works very well in the kids who show temper tantrums on their parents for making the thing happen as per them, or they will kick and scream and fall on the floor, and they will show such type of temper tantrum. In this case, tuberculinum doses works well.